Thank you for joining us. I'm Naiba Reynoso. This week, we take you inside the county's multifaceted response to COVID-19. Meet a real-life COVID detective, tour a vaccine storage hub, and see how inspectors make sure restaurants are compliant with safety regulations. But first, hope is here with the opening of 5 mega vaccination sites and more on the way. Supervisor Holly Mitchell was on hand at the forum in Inglewood, where a shot in the arm is something to celebrate. Take a look.
We are in Inglewood in the 2nd Supervisorial District, the iconic forum, which has been a testing site for weeks now, and they're adding vaccinations. We're not asking people to go outside of their communities and to travel far. We've been working very hard to make sure that particularly areas that are underrepresented, that don't have access to community-based health systems and services, have access in the middle of this public health pandemic.
To put together a testing environment with 5 megapods is a pretty large endeavor. So public health, along with the fire department and LA County Department of Internal Services, ISD, have joined together to work in a unified fashion. Checkpoint 1 is just a simple opportunity for us to verify that they have an appointment. They go around the perimeter of the parking area and they enter checkpoint 2. And once they've been verified, then they can enter one of 15 lanes and they can move forward to the actual vaccination area. The aim is to get up to 4,000 vaccinations per day at this site. Our plan at this point in time is to run 7 days a week from 9 a.m. till 4:30 p.m.
We have a huge cadre of healthcare professionals who are at the ready, and our disaster service workers ready to respond in this situation. Did you have an appointment?
It's very emotional. It was painless, I'll tell you that. Painless, and I feel fine, but just an emotional, beautiful moment. The end is in sight.
This virus has disproportionately impacted us in a profound way. I am lending my voice so people know to please come out once you are eligible to come out and get the vaccine. The only way we're going to get on the other side of this surge is to vaccinate more people, as well as encouraging people to stay safe at home, wear your mask, wash your hands, and socially distance.
Frontline healthcare workers are top priority for vaccination so they can continue to care for the sickest patients. For many stretched to the limit, the second dose is heaven sent.
I'm a nurse in the emergency department. I'm here for my second dose today. We have waited 9 months for this, and so the thought that this could actually be the beginning of the end of this epidemic is fantastic. Getting the vaccine can get us back to some sort of semblance of normalcy and open up our lives again.
Today was my second dose, so I've now completed the 2 doses. First dose went off smoothly, second dose just got now and feel very well. So I'll go home and rest for a little while today and then go back to work tomorrow. It's an incredibly safe process and an incredibly safe vaccine from what we've seen so far.
I work in the ICU. I'm in the trenches with the nurses. It has been emotionally and physically draining for everyone. We've been working nonstop to take care of our patients in this community. Now I feel more safer that I got the vaccine and I can go in there and take care of our patients. I had only just arm pain, no other side effects than that, and I'm fine with it now and just keep on going.
I got the vaccine specifically for my community. I identify as a Latina, and I know that there's a lot of Latino patients out there who mistrust the system and have not trusted the medical community before. So I want to show them as a doctor, as a person of color, that we can trust the medical community and hopefully move forward from COVID.
It's a complex operation to move vaccines from point A to point B under tight deadlines and carefully calibrated conditions. Take a look at how the county is protecting this precious resource.
8982. So we receive our shipment of products once or twice a week in an unmarked truck. When the shipment comes in, they're offloaded, they're inventoried. We verify their facility name, their pickup information, the allotted amount of doses that they're receiving, and which brand, whether it's Pfizer or Moderna. We package it in ice packs and bubble wrap. We verify the temperature's correct. We package it all back up and take it back out to them. Then we give them a second ancillary box, which has all their needles and syringes and prep pads and vaccine cards.
What happens is when they return the vaccine at the end of the day, one of these will come with each cooler. So what does this do? This records the temperature throughout the day. Here's one, and the reading, it'll show the current temperature.
Right now it's recording negative 71.26. If anything goes above or below, then you'll page the contacts.
If the chain is broken, we have to determine if the vaccine is still good or not. And so that would involve some additional guidelines that Moderna and Pfizer have released to us in terms of allowable excursions. We carefully look at that data before the vaccine is used.
Bon appetit! Restaurants in LA County are operating outdoors once again, but with new restrictions. See how public health investigators hit the streets to make sure your dining experience is safe.
Today, I'm here to do an investigation on the restaurant to see if they're in compliance with the health officer order to stem the coronavirus pandemic. We go to restaurants to guide them, to inform them, to check out the measures that they're doing to ensure that the public is safe. Before we even get inside, we check for physical distancing markings and the proper signage on the doors. We have a generated list that we go over with the person in charge to make sure they're in compliance with the health officer order. We ask all these questions to facilities so that we can ensure that they're doing infection control, physical distancing, and also communicating with the public.
Every day our team members are going to come into their shift. We take their temperature right at their forehead. It states 97.8. It comes in green with a little smiley face.
Our first priority is the safety of our team members and guests. You know, it has been a difficult transition, but here at BJ's, we strive to always say yes to our guests. It is our job to make the guests feel welcome, safe, happy to be here. Through this difficult time, we're just excited to be open.
I think that it's great that public health is coming out, making sure everything's up to par. And yeah, it's uncomfortable with the mask and, you know, the distancing and not the crowds. But honestly, I appreciate it. If it's to help us better the situation, then I'm all for it.
Contact tracers play a critical, if behind-the-scenes role in slowing the spread of COVID-19. Meet Levon Gardner with the Department of Public Health. If he gives you a ring, it's one call you'll want to take.
My name is Levon Gardner. I'm currently a contact tracer, and I work with the LA County Department of Public Health. As a contact tracer, my job is to reach out to people that are currently positive for COVID-19. We also are able to reach out to anyone that may have had close contact with them. The entire purpose of the call is basically to make sure they have general information about COVID. They understand their isolation period. They understand actually what the virus is and the effect that it can have them and whoever else may have had close contact with them. Not every call we make is pleasant, but sometimes you reach out to people and you hear the gratefulness in their voice, and it's the best thing about this job. You see people really happy that we are providing the service for them. We see COVID-19 cases going up like wildfire right now. I can only imagine how high those cases would be if we didn't have contact tracers.
In closing, we pay tribute to Paul Foley, who passed away from COVID-19 last April, leaving his daughter devastated. Our thoughts and prayers go out to all those suffering the pain of loss, and will continue to bring you their stories. We'll see you next time on LA County Close Up.
My dad's name was Paul J. Foley Jr. He got COVID in March of 2020 and then died on April 17th of 2020. Yes, my dad was 77 years old, completely healthy, not a single underlying condition. He was the most active person, and he was healthy as can be, and then it just ravaged his body, and 3 weeks later, he's dead. I'm thankful that I have that text, because at that time, I didn't, even though it's a silly, innocent text, I never knew then that it would be the last time. You don't want this heartbreak. I had to say goodbye to my dad on FaceTime. A dad who raised me and taught me everything that I know in life. That is not how you want to say goodbye to somebody.